Hello, my name is Chelsea Dunston. I am the Inpatient Stroke Program Coordinator at Atrium Cabarrus, and I have case studies for you all. First and foremost, I would like to remind you to pre-alert the Cabarrus ED for any patients with an abnormal men's exam. The information we need from you is the patient's name, date of birth, symptoms, and your ETA. The reason we ask for name and date of birth is so we can review the patient's chart prior to arrival. Upon arrival, we will ask you all for the patient's weight, their blood sugar, blood pressure, and if you were able to get a 20 gauge IV in the forearm or above for CT scans. Patient number 1 is a 61-year-old African American male. He has a past medical history of hypertension, hyperlipidemia, and a former smoker. On presentation, he was found down after being heard by his wife falling. He had altered mental status, incomprehensible speech, right hemiparesis, and neglect. He also had a left gaze. As you can see, the abnormal MEND exam performed by your EMS staff. The patient's last known well was 2240. First EMS contact was 2244. Arrival time to the Cabarrus ED was 2302, and CT time was 2322. That gave the patient a door to CT time of 20 minutes, which meets our goal. The patient had a CT perfusion scan, which showed a large vessel occlusion of the left M1 area. The picture to the right is what we call our mismatch volume, and he had 25 cc's of damaged tissue and 111 cc's of salvageable tissue, making him eligible for thrombectomy. The pictures also demonstrate correlation with his right-sided symptoms. The patient received TPA at 23:51 with a door to TPA time of 49 minutes. Our goal is 45. The decision was made at midnight 30 to take him to intervention. He arrived to the hour suite at midnight 45 with a door to our arrival of 103 minutes. Our goal is 60. And his final revascularization time, which means the interventionalist was satisfied with the amount of blood flow restored, was 2:08 a.m. These results show the before and after of the angiogram. On the left, you have the before with a large area of brain that is not being perfused. On the right in the circle is the area of restored blood flow after the thrombectomy. This patient had 4 passes of suction and stent retrievers with a resulting score of a TICI 2C. That means the patient had nearly full revascularization. It just may be a little bit slower than before. His follow-up MRIs show multiple left middle cerebral artery infarcts. The white tissue of the brain is the damaged stroked tissue. This patient was discharged to inpatient rehab with some lingering right upper extremity weakness and ataxia. Patient number 2 is a 28-year-old Caucasian female with no known medical history. She was found slumped over on the floor, diaphoretic, aphasic, with bilateral lower extremity weakness, left upper extremity weakness, and right upper extremity contracted. Her entire right side was drawn. To note, her blood pressure on EMS arrival was 180/130. She's left-handed, and she was a very difficult stick for EMS. She arrived to Cabarrus without an IV. The patient's last known well was 6 a.m. First EMS contact was 8:01. Door time to Cabarrus ED was 8:36, and her CT time was 8:57. She barely missed the 20-minute mark. This patient also had a CT perfusion scan that also showed a left M1 occlusion. She had 265 cc's of already damaged tissue, but she had 405 cc's of salvageable tissue. This also fits with her right-sided symptoms and made her a candidate for intervention. Her TPA time was at 9:35. Her door to TPA time was 59 minutes. Delays noted for blood pressure management, as her blood pressure on arrival to the ER was 197/106, and as we previously mentioned, she was a very difficult IV stick. The decision was made at 9:10 to take her for intervention. She arrived in the IR suite at 9:43, and she had final revascularization at 12:44. The image on the left shows the area of brain that is not being perfused, and the area on the right shows where the interventionalist was able to regain perfusion by removing the clots. This patient ended up with a TICI 2B and was considered unsuccessful due to inability to revascularize the left anterior cerebral artery. She also was left with non-occlusive tiny emboli within the proximal left posterior cerebral artery. The provider was able to open the left middle cerebral artery. This provider made 11 passes. On the follow-up CT, the patient had a very large left posterior cerebral artery basal ganglia infarcts, as you can see circled in yellow. This patient was ultimately transferred to CMC Main due to the size of her stroke and her age. She was intubated at the time she left our facility, unable to follow commands. She had left eye deviation, unequal pupils, and was experiencing tonic-clonic seizures. The patient had a hemicranie, where they removed part of the patient's skull to allow for swelling. And as you can see, she had a massive left hemispheric infarct. To date, the patient remains at CMC Main. She is now extubated. She is able to follow commands on the left, which, as previously mentioned, she is left-handed. She has severe right hemiplegia. She is able to speak a few words, and she has passed her swallow screen. Case number 3 is a 68-year-old Asian male, history of diabetes, smoker, hypertension, hyperlipidemia, previous stroke, coronary artery disease, MI, and colon cancer. On arrival, he presented with left lower extremity weakness, left facial droop, and slurred speech. Below you can see his abnormal men's exam. His last known well was 3 a.m. First EMS contact was at 3:50. Arrival time to Cabarrus ED 4:18, and CT time was 4:37, with a door to CT of 19 minutes, surpassing our goal. This patient also had a CT perfusion scan noting a right-sided occlusion. He had 48 cc's of damaged tissue, 180 cc's of salvageable tissue, which fits his left-sided symptoms. This patient was also a candidate for TPA and thrombectomy. This patient received TPA at 5:01 with a door-to-needle time of 43 minutes, surpassing our goal of 45. The decision was made to take him to the intervention suite at 5:09. He arrived at 5:48 with final revascularization at 7:05. The provider made 3 passes and considered the patient a TICI 2C, which is near complete revascularization, maybe slightly slowed. On the left, you can see the big gap and lack of perfusion, and on the right, you can see the new perfusion circled in yellow. This patient had a successful case. His follow-up MRI did show multiple right hemispheric infarcts, as you can see evidenced by the white spots on the scan. He was discharged home with home health physical therapy and speech therapy with minor left upper extremity weakness and paresthesias. Thank you for your time.